Well, thank you very much for taking time out of lunch to talk a little bit about this amazing experience that I had. And I really thought I'd be sitting in one of the small rooms of about 10 people, so I didn't expect to have quite the audience. And I thought it was going to be pick a city, I'll talk to you about it. I don't think it's going to work too well in this context. But I'll tell you a little bit about what I did and why. So these are my conflicts, which I kind of forgot to put in the other slides. So futures here, it's not evenly distributed, is a quote from a guy called William Gibson. And the concept is that anything new is not evenly distributed. It starts in places and then picks up. The best visual that I've come up with, and I actually wound up shooting video for this while I was traveling because I just wanted to share it, is a concept when it comes to digital innovation of rain. And imagine if you look at the ground, you see a drop here and a drop there and a third one, a fourth one, it slowly starts to drop even faster, and then the rain comes closer and you start getting pools. That is basically how technology is adopted, particularly in healthcare. It's slow, it's focal, it's usually done by people at the leading edge. And over time, you get to see the patterns emerge where it really did work, where it didn't work. And so to some extent, the idea of the future is here is that there are going to be pockets of innovation that happen that may not be in our backyard. In order to be aware of them, you have to kind of go visit. Now, at UCSF, we have a sabbatical policy. It turns out nobody in orthopedics ever heard about it. It's part of our compensation, and it is true across the UC system. And the requirements for your time away is that you come back a better educator. There really isn't anything more than that. The idea is to take time away to reflect. And in other areas of the university, like maybe, say, economics, people use the time to finish books, to finish research projects, or occasionally go and do research at other institutions. So when it came down to deciding how I'm going to spend this time that I was about to take, and I thank my colleagues for allowing me the opportunity to do so, was to either go and talk orthopedics and focus on some of my passions around alignment strategies. But that, I feel like I kind of knew pretty much what everybody was doing already, pretty much around the world. And so the question came down, my other passion is technology and innovation and the digital transformation in healthcare. So I started on this trip to look over the horizon because I know quite well from my experience you simply cannot judge the future by the present. If you do, you'll be sadly disappointed. And so I started the Digital Transformation World Tour 2024 to visit centers of innovation or individuals and learn. It was really a learning tour, maybe occasionally share what I knew when I was asked to do so, and occasionally educate. And what will come with this are 40 interviews that I've conducted around the world with some pretty amazing people, each of which will become an episode in my podcast from the Digital Orthopedics Conference, and will highlight the learnings. And I'll just give you the shorthand of it, is that I met some extraordinary people, some of whom we'll get into more details now. If it was a shared attitude, it was one of curiosity. It was people that asked the question, does it have to be this way? Are there better ways? How can I change the outcome for my patients? So we started west. I went with my wife. Our kids were appropriately packaged off. And we went from San Francisco all the way back to San Francisco by going west. So we started in Sydney, where I grew up, and where New Year's Eve is an extraordinary, amazing event that should be on everybody's bucket list. And there, unfortunately, everyone was pretty much on vacation for the following 2 weeks of midsummer. But I got a chance to meet this gentleman who runs a podcast full time. And what he does actually basically goes around the country of Australia, promoting and connecting people, promoting digital innovation transformation and connecting people. And has been so successful, he's actually made it a full-time job. The lady to his right, he's actually a consultant from formerly, I think, one of the big consultancies. Now works for a small group, in Sydney to help and develop innovation. And because it's largely, like so many other countries besides the US, a state-run health system, the state itself actually creates possibilities and financing for companies to get started. So this is in Melbourne. This is And Health, another of our faculties closely involved with them, Amanda Sawyer. And it's a woman-run incubator. And they do a fantastic job of incubating, and their goal is to spend government money, and the outcome that's expected is that they start new companies that are ongoing 1 year past the due date. So they're not actually required to show success, just to kickstart a local innovation and technology platforms. And one of the companies that I met with them at that point has since gone quite well. And they were able to create surgical anastomosis vascularly, endovascularly, with essentially a minimal intervention and solved a great deal of problems. Imagine if you're trying to anastomose vessels in the abdomen one by one. These are all technology driven. So not always orthopedic. But as I was traveling through Australia, I started having an anchoring for meat pies. One of the questions I had were, where are the best meat pies? So I started having a lot of meat pies, and I'll tell you at the end of the story whether Australia or New Zealand has the best ones and why. So after Australia, I went on to New Zealand, and I wound up having a connection with some venture capitalists, and this is where they had their meeting on the left. And so I wound up borrowing a bike and going for a long mountain bike ride with these guys and talking tech and talking innovation. And New Zealand's issue is that they have an extraordinarily educated group. This on the right is the University of Auckland's Technology Center. And these guys are doing some really phenomenal work, and it's very cutting edge. There's absolutely nothing to say Europe or Australia or America. I mean, their quality is good. But what's interesting there is they can test anything they want. They don't actually have an FDA. They borrow the Australian one. So if they want to design a product and use it in the OR, they basically flash it. And so innovation there goes very quickly, and then it's very quickly exported to the bigger markets, which include, for them, they're in a market group with Australia and Singapore. Then I also got a chance to meet Mark Clatworthy and Simon Young, and it's I thought I'd throw a slide in because of the very curious technology that they've adapted to get around New Zealand. So that boat has 3 wheels on it, 2 in the back, 1 in the front, and 2 large power things, and they literally will go up to a beach, put the wheels down, get up on the beach, get off the beach, get back on the thing, and get going. And it's actually quite fun to hang out. So both of these guys are big-time orthopedic surgeons in New Zealand. They do some great work. If you haven't seen, both Simon and Mark have presented almost every year at AUKUS, and it was interesting to talk about their practice patterns in New Zealand, which is really quite different because of these regulation policies. Got to Singapore, and the gentleman on the left is actually very, very interested in digital health as a way to deliver care across an underserved population. And we talked in detail about the opportunities that are available in this part of the world. And when I then spoke with this gentleman with the thumbs up, he is the head of innovation for Microsoft in Southeast Asia. And essentially what's happening in Southeast Asia, of all the countries I visited, is by far and more the most dynamic environment you could possibly imagine. It makes the rest of the world feel like they're sluggish and falling asleep. The openings for applying technology to healthcare innovation to deliver care to an underserved population is massive. And what's even more interesting is that it's not a fixed pie. You can go into that market with a product and partner with your biggest competitor, and you will both grow unlimitedly for a very long time without worrying about having to eat each other's lunch. It is such a potential underserved community that the markets are just dying for the resources. And this does not include China, which I didn't go to, but India, Malaysia, Thailand. Malaysia, for example, I'll get back to Malaysia in a minute. And this gentleman to the right is a fellow who was with Ben Ma, our chairman, on the fellows tour, and he has built a sensor technology to track mobility and motion, and he's trying to make a go of it in Singapore. But what happens in Singapore is that they become the conduit to the rest of the Eastern Southeast Asia. So you've got this amazingly dynamic, productive, advanced, technology-driven Australia, New Zealand, feeding technology through Singapore to the rest of Southeast Asia. So it's an interesting sort of way that things are being promoted. And surprise, surprise, I'm at lunch, and I'm look over one of our residents is having lunch with his wife in Singapore, and I was like, "You've got to be kidding me!" It's like how small world is this? Then we got to India. I've been to India many times. I've operated in India. I've visited India. I've toured India as a young man with long hair. I find it an extraordinary country full of just remarkable things. But just two people I met with. This gentleman on the left used to work at IBM. His wife was a tenured PhD type, scientific type in the East Coast somewhere. I can't remember where exactly. And they left their job to come back to try to help their fellow man. And they've created a platform to deliver medical care anywhere, essentially from a box. And it's all, of course, computer-driven and software-driven. But where they had an interesting insight is that, in fact, if you're in a war zone, or if you're in a flood zone, or if you're in a desert zone, the technology required differs, as do the diseases you treat. The gentleman in the middle has a fascinating story, one of my favorite people I met. He started out as a med student, family physicians, middle of India, got into U.S. training for orthopedics, came, decided didn't like it, went back. Finished his training in India, and then opened a hospital. Now, what happened in India in the last decade or so, the Modi government did two things that you wouldn't think would be particularly related to healthcare. They gave everybody a single unified patient ID number, which wasn't the case before, and we still do not have in the United States. And secondly, they forced all the banks to allow digital transfer of funding through phones without charging. So if you transfer 1 rupee, the charge could have been 10 rupees. So they allowed people to start transferring funds. Now that everybody had access to money and had an identifier, they could shift funding directly to patients to spend as they wanted in healthcare. What then happened was that an entire ecosystem of health systems developed to take care of these people. And now these folks could become a recurring revenue model for these hospitals. So this gentleman opened a small hospital, wasn't doing well. This change went in place, and then folks no longer went to Delhi because they could stay there and pay for their care there. And now he's opened a 500-bed hospital. From there, went on to Kerala, and at some point you have to cut me off. I want to go over this in a little bit of detail because it's one of the things that left the biggest, touched me the most in terms of how I think about innovation. So the lady to the far left in this image is Amma, and Amma means hugger, I think is the actual thing, but she is a lady who was born in one of the poorest possible environments ever. She was born in Kerala, which is southeast India. It's one of the poorest parts of India. Third child of a fisherman in a 2-room abode close to a beach. Her job for the family was to go pick up scraps of food from the neighbors' kitchens and the floor to feed their animals. And as she did this, she walked around these places, she wound up seeing that people were in even worse situations than she was. And she started to deliver like empathic care, hugs, and just spend time with people. And over time, she got a bit of reputation for doing this. And she became considered a healer. At age 15, she was already sort of going around, basically her full-time job, if you will, was take care of people. Fast forward to now, she's 70-some years old. She was born in the 50s. She has built a massive infrastructure to support the poor. She has opened 5 universities, each of which give 40% of students full education for free. She has opened 2 hospitals. One's 500 beds, one is 1,000 beds. They're absolutely state-of-the-art. She has built all the infrastructure you see in these pictures. These are all, one is a biomechanical institute, the other one is a AI institute. The gentleman sitting next to me is in charge of the AI section, which is how we got together, looking at opportunities to use artificial intelligence to help poor people. She has spoken to the UN. She has spoken at the World Health Organization. She is a co-signer with the Pope and other major leaders of healthcare. She sent $1 million in funds to the United States for Katrina's help. And she has the largest group of disaster supporters in the world that she deploys at a drop's moment. She lives like a monk. She has no personal assets. I saw her give hugs to 2,000 people, one by one, until they were done, in an event that she hosted at her ashram, which is basically a monastery. So after watching what this poor woman had done, she still does not speak English. She never did go to school. She directs boards for these huge corporations. There's one of the things I learned is never say can't be done. Right? Just don't say, maybe you can't do it, but don't say it can't be done, because between him, her, and others I've watched do things, it was pretty remarkable. And then from there, I went to Dubai, the antithesis of what I'd just seen in Kerala. And there I went to this conference, it's the technology conference, which could have been in San Francisco, the same companies or similar companies doing similar things. But the Middle East is having a bit of an issue, because for those of you familiar with Dubai, it's a country that doesn't have much oil. It's the poorest of the UAE group. And they've tried to build this entire economy based on tourism and tax issues, but they're growing like crazy. They had 1 million Russians show up in this past year after the war in Ukraine broke out. They have grown 10 million in the last, I think, several years, and they're planning to grow 10 million in the next 10 years, and the infrastructure is not keeping up. And so healthcare is one of the big issues that they're trying to deal with. So we have two major problems. One is that they had McKinsey come in and fix their healthcare system, which was originally based on the NHS. And McKinsey told them to make it a more market-driven thing and fee-for-service, which worked great until they realized that something like 30% of the billing that they get is fraudulent or unnecessary care. And so now they're having this huge issue trying to rein back in the cash that's going in and out of the system. So I also, and the gentleman here with the third picture on the right, so there's one more person, not in this picture because it got cut off, who actually sat me down and gave me a whole lecture about what's going on in the Middle East, who had his own personal photographer take shooting pictures of him, whoever he was sitting with. It was kind of an interesting, completely different environment from what I'd just come from. This gentleman I bring up because he was at McKinsey himself, and he left. He wanted to start a diabetes. So diabetes is an issue in the Middle East. And what they had to do is try to figure out a way to manage patients at a distance. And so what he built on the far right there, he felt that after much trial and error, tech by itself isn't sufficient, but buildings themselves are not sufficient. So he merged the two. And when you go through his offices down there, they're about to open a second one, the entire experience is digitally connected, so that it's almost like going to Disneyland. You go A, B, C, D, E through the system. Everybody's waiting for you to go through it. They check whatever it is, and then they track and follow you with a really powerful app. And their results are the best published diabetes management in the world. But I love the way that they control two things. We also went to Egypt, and I didn't do any tech stuff there, but I just wanted to point out, it was probably one of the most impactful trips that I had. That column to the left, the paint color, I don't know if you can see it, but you can still see paint on it, is further from Cleopatra than Cleopatra is to us. In other words, it's 3,000 plus, no, it's over 3,000 plus years old that they built these things on the Valley of the Nile, which are just extraordinary, and the paint still is visible. It just, that whole section, the whole visit absolutely blew my mind. Last one I do is Istanbul. Then I had all of Europe to follow, and it was just fascinating. But there I met with Jay Parvizi, who introduced me to his research team on the left. But what really blew my mind, and it was is a group that he works for. So Abidev, this is one of their hospitals. All their hospitals look like this. They look like the latest and greatest. To the far right, what you see is essentially it looks like NASA. It's their control room for their hospital. Every room is figured in here. They know when nurses go in and out of a room. They know when a nurse is late to answer a phone call or a bell. They're able to track the pharmacy. Every aspect of the hospital runs through this control system, and then they use it for feedback loops. They run their own cloud, not AWS, so they can fully control it. They built their own electronic health record, and they're the second largest healthcare system in the world after United Health. They are in almost every country in the Middle East. They're almost in every country in Europe at some level, and they go all the way over to Malaysia. They manage electronic health records in multiple languages, but also in multiple characters, right? And they're able to implement digital innovation at the speed of light, essentially, because their entire infrastructure is not burdened by historical technological data sets. So and this I just got through. Then we got to Europe, and Europe was a whole different kettle of fish with different set of problems. in the end, what happened was I saw that innovation isn't so much in other parts of the world. Innovation is further ahead of the United States. I think that possibly in terms of what's cutting edge, we have it here. I didn't see anything different there. What I did see is a different infrastructure and willingness to tackle the challenges that are handled at a country level by having the government get involved in partnership with technology startups, venture capital, and the health groups to actually have practical answers. The vast majority of countries around the world have issues with the same three things we do: access, demand, and cost. But they're taking the point of view that through technology, a lot of the costs can be reduced and a lot of the access can be improved. And I think Claudio mentioned this earlier as well. And thereby optimizing the healthcare system to keep us going a little further. My last point to all of you is that the healthcare system is not broken. If I hear that one more time, I don't know what's going to happen. Nothing's going to happen. But it's like, it's doing exactly what it was designed to do in 1948, 49, and 50 when it was designed. We need a new healthcare system. The current one was designed to solve different problems. And so for us to be able to move forward, to look at seeing alternate paths, and what you're seeing in some of these external countries is the beginnings of experimentation of technology-backed delivery of care methods, which seem to be working quite well. So with that, thank you. If you want to listen to the podcast, follow me on LinkedIn. That's probably where I post the most, and I'll have the podcast available once this current cycle of talks ends. Thank you.